So firstly, just a quick disclaimer. So just to say that this presentation is not a substitute for medical advice and is intended for educational purposes only. We will be touching upon infertility and baby loss. So if you do feel triggered at all, then please, don't hesitate to excuse yourself from the session. It is being recorded, so you can come back to it. If you do feel the need to, you can contact one of our fertility counsellors or a relevant medical professional for any additional support. And just to say as well that everything that we're going to be talking about today will be for, it's not going to be specific, it's not tailored advice, it is just general advice. I'm just going to check the questions a second to see that you can hear you. Oh, okay, it's nice. It's a nice comment. Okay, now let's hope that I can close that. And this one. Okay. Sorry, gosh, I'm definitely not very good at IT. Oh no. Why is this in my way? Sorry. I can't move it. Okay. Right. I can't move. Okay, right. I'm so sorry. Okay, so we are going to be talking about Preganuary and how to eat for your fertility. So just a little bit firstly about fertility. So if you didn't know already or you've not taken a test before, fertility is committed to providing a proactive approach to not only fertility, but also for reproductive and hormonal health. So we provide people with vital access to information about their bodies through a thorough online health assessment and at-home blood test. So whilst we know that fertility is affected by a multitude of factors, we believe that checking your hormones and giving your body the best chance through proper nutrition is a great start. So that's what we're going to be discussing today. So I hope that you can see this because my bar is in the way for me, so I hope it's not for you. Okay, so I am the fertility nurse and clinical nutritional practitioner at Fertility, a bit of a mouthful. So I'm a registered nurse and also a registered nutritionist, and I specialise in fertility, reproductive health and conditions such as PCOS. I've got a master's degree in clinical nutrition and public health, and I hold both fertility advisor consultations at Fertility, but also nutrition consultations as well. I may have spoken to some of you before, so if I have met you before, hello again, and thank you so much for coming. So what we're going to cover today, we're going to cover preconception health, ovulation and your fertile window, what lifestyle factors affect fertility, nutrition for fertility and preconception, provide you with a preconception toolkit, and know when to seek support. So preconception then, so I guess firstly, what is preconception? So preconception is essentially anything before conception. So it's the health of you prior to conceiving. So you could think about that in the context of literally your entire life, but more importantly, we're going to be focusing on this period right before conception. So around sort of 3 to 6 months before conception. So why is good preconception nutrition important? Well, it improves the chances of having a safe and healthy pregnancy and baby. And we also know that diet and lifestyle is crucial for the first 1,000 days of a child's life. So that's from preconception up until a child is 2 years of age. But we're also really interested in the period prior to conception. And that's what we're talking about today, because we know that nutrition and lifestyle factors are heavily involved there. So how can poor preconception health affect pregnancy? Well, lifestyle factors can have a cause on genetic, cellular, metabolic and physiological changes during the baby's development, and that can have a knock-on effect even throughout that child's life into adulthood. But we also know that maternal deficiencies in the key nutrients required for fertility and for pregnancy can be linked to restricted fetal growth, preeclampsia, neural tube defects, skeletal deformities, and low birth weight. So for conception then, so here are the things that are required. So firstly, we need a healthy egg, we need healthy sperm, we need successful ovulation to occur, we need successful fertilization, and we need successful implantation. So when should you start? So as soon as possible, to be honest. So we know that the process of eggs that mature are going to be ovulated is around about a 3 to 4 month process. And similarly, for the process of sperm to develop, we know that that's around a 2 to 3 month process. So really, whatever you eat today could have an impact on either egg or sperm health in 3 months' time. So that's why it's really important to optimize your nutrition and lifestyle factors in this 3 months prior to conception. Okay, so your menstrual cycle then. So just a recap on your menstrual cycle. So your menstrual cycle is biphasic, which means that there are 2 phases. So the first phase is the follicular phase, and then the second phase is the luteal phase. And then we've also got menstruation, or your period, which is at the start of your cycle, and then we've got ovulation somewhere there in the middle. So some of the key hormones here that are involved are follicle stimulating hormone, estradiol, luteinizing hormone, and progesterone. And if you've taken a fertility test before, you would have had, if you're not on hormonal contraception, you would have had your cycling hormones tested. So these 3 here. And we test those because they can give us insights into your menstrual cycle and ovulation, but also we can use them to help make diagnosis. So just to give you a bit of insight into these hormones, so follicle stimulating hormone, which is this yellow line here, this is the hormone that's involved in the maturation of your follicles. And it's the follicles that contain the fluid-filled sacs that contain your eggs. So you can see here that follicle stimulating hormone just peaks here and then starts to go down. And then we see estradiol take over. And it's the follicles that produce estradiol. Then estradiol makes the switch from follicle stimulating hormone. And then we see this surge in luteinizing hormone just before ovulation. And then it's the luteinizing hormone that triggers ovulation. And then we see it drop back down, and we'll see progesterone steadily rise throughout the luteal phase. And that's because once the egg is ovulated, the follicle that it leaves behind in the ovary is called the corpus luteum, and it's the corpus luteum that produces progesterone. And if you were to become pregnant, it would be, you'd see a steady rise in progesterone then throughout pregnancy. So ovulation then, so in a textbook 28-day cycle, which is definitely not the case for everyone, we would expect to see ovulation at around day 14. So it's 14 days prior to your next period. So obviously, even if you do regularly have a 28-day cycle, it's likely not to be a 28-day cycle every single month. It's still probably going to vary here and there by a few days. For anyone that has a cycle that is shorter than 21 days or longer than 35 days, we consider this as irregular. And if you haven't sought support for that before, we would recommend going to see someone about that. So what are the things that you can do if you are experiencing irregular cycles? I'm just going to move this bar up again, sorry. I hope it's not in any of your way. So what can you do to regulate your menstruation and ovulation if you are someone that's experiencing irregular cycles? So there's some research from this study in 2007. It was quite a big cohort of people that they looked at, and they found that making 5 or more dietary and lifestyle changes was associated with a nearly 70% lower risk of ovulatory infertility. And so some of these recommendations here came from some of these food examples. So for example, good quality, low GI carbohydrates, so low glycemic index carbohydrates. So things such as beans and pulses and sort of fibrous foods, fruit and veg and whole grains. Full fat milk. So we know that there's some research there in terms of benefits for female fertility, and it seems to be the opposite for males. Healthy fats, so mono and polyunsaturated fats, and we'll get to those a bit later on when we discuss the diet, and multivitamin use, so likely due to preconception supplements and intake of plant-based proteins. So we also know that exercise plays quite a huge role in regulating your cycles, but it really is important to get the right balance. So there's a study here that showed that aerobic and resistance training 5 times per week of moderate to vigorous intensity over 20 weeks increased cycle regularity. I do think that this is really important for people with PCOS. From the research and anecdotally from clients that I speak to, we know that when people up their exercise, that they do start to see their periods return. So it definitely is something that you can look at implementing if you are struggling with cycle irregularity and you're not currently exercising. But again, it is about finding the right balance. So maybe not going so vigorous if you are actively trying to conceive. Okay, so how to identify your fertile window then? So what is your fertile window? So this is the time when you're most likely to conceive. And so the fertile window goes from your ovulation day. So again, looking at a 28-day cycle. So let's say day 14, and then the 5 days leading up to ovulation, including the day of ovulation. So it's 6 days in total. And so this is the best time to have sex to optimize your chances of conception. So in terms of trying to figure out when your ovulation is and when your fertile window is, we need to establish exactly when ovulation is. So there's some things that we can look out for to help us try and figure out when our ovulation is occurring. So one of those is tracking your menstrual cycles. And another of those is changes in basal body temperature. So just after we ovulate, we should see a rise in our body temperature, anything up to a degree. So if it's just sort of 1 month that you're looking at, it's kind of not the best use, because it's just going to give you a snapshot of 1 month and you would have already ovulated. So it's best, over time with tracking, if you were going to use that method. So we would also expect to see changes in cervical mucus. So we would expect the mucus to be sort of a stretchy consistency and to resemble sort of an egg white. And again, we'd expect to see that in that fertile window. Ovulation pain, it's called Mittelschmerz. It happens for up to 40% of females around ovulation. It tends to be one-sided, and you also may get some breast tenderness pain. Ovulation sticks. So for people that use ovulation sticks, what they do is detect a surge in luteinizing hormone, which we said happens just before ovulation. So you can see again this peak here, and that's what ovulation sticks pick up. And then we know just after that, then we should be ovulating. So when is the best time to have sex? So NHS and NICE recommend to optimize your chances of success. You should have intercourse every 2 to 3 days throughout the month. But knowing what we know and what we've just spoken about, we know that our fertile period is within this 6 days. So therefore, it would make sense for us to have sex every 2 to 3 days, particularly within that fertile period. And it's also thought, although the evidence is a little bit contentious, that 2 to 3 days of abstinence is optimal for sperm quality. So again, that's kind of where that theory of every 2 to 3 days, especially throughout that fertile period, may be best in terms of your chances of conception. I hope that makes sense. So let's get into nutrition then. So maintaining good nutrition can help to regulate hormones and your menstrual cycle, as we just looked at, improving egg quality, improve chances of fertilization, improve sperm quality, improve chances of implantation, and manage conditions that affect fertility. So factors that affect fertility that diet cannot fix, unfortunately, age being one of those. There's nothing that we can do about our age, unfortunately. So our ovarian reserve does start to decline with age, and we see a more rapid increase, even more so in our 30s and sort of late 30s. But we also see a decline in the quality of our eggs as well, especially after the age of 35. And then this can put us at increased risk of things such as miscarriage. So genetics, nothing we can do about our genetics. Structural causes of infertility. So for example, in endometriosis, for example, there may be some adhesions or scarring there that may be a structural cause. Certain health conditions, lifestyle factors, medication, for example, for cancer, drugs, so for example, in chemotherapy, surgery, for example, if you've had an ectopic pregnancy and had a fallopian tube removed, unexplained fertility, and again, a structural cause of infertility could be pelvic inflammatory disease, which can occur as a result of untreated STIs, so gonorrhea and chlamydia. So when can nutrition have an impact or play a role in fertility? It's at the start because I really do think it plays such a huge role, polycystic ovary syndrome. And I really do feel that actually having nutritional support for PCOS can be really beneficial in terms of managing your symptoms, but also and regulating your periods, but also in terms of fertility. Diabetes, it's really crucial that people with diabetes keep their blood glucose levels under control in terms of fertility, but also pregnancy. And again, due to the insulin resistance, the same with polycystic ovary syndrome. For those that have got insulin resistance, we want to keep our blood glucose under tight control. Eating disorders, obviously I mentioned endometriosis on the last slide in terms of structural causes, but although nutrition doesn't directly impact endometriosis, we know that by reducing things like inflammation, it could help with the symptoms of endometriosis and therefore have a knock-on effect to fertility. Uterine fibroids, for example, if you're experiencing a lot of bleeding, you could be at risk of an iron deficiency, and we want to make sure that we go into pregnancy with good iron levels because it can affect fertility. Nutrient deficiencies, and I guess to say here about unexplained infertility. So for some people that do have unexplained infertility, it can be useful to look into diets and nutrition, because in some cases, for example, one of the tests that's recommended by NICE when people have unexplained infertility is to look at celiac disease, and that's because with celiac disease and unmanaged celiac disease, not well controlled celiac disease, when it's not well managed, it can cause inflammation in the bowel and it stops the nutrients being absorbed. Thyroid disorders, so we really want to make sure that our thyroid's under tight control before we commence pregnancy, and actually fertility treatments as well. Those are some other hormones that we check for everybody at fertility, again, because it does play quite a huge role. Well, it plays a huge role in fertility. Functional hypothalamic amenorrhea, high or low weight, ovarian reserve, although the only real research that we have really in terms of nutrition and ovarian reserve is that low vitamin D status can be associated with a lower egg reserve. Other than that, there's really not a lot that you can do in terms of diet, but there is in terms of egg quality. Assisted conception, so we know that nutrition plays a huge role in outcomes in terms of fertility, nutrition, and also the role of it in a healthy pregnancy. I actually was going to ask how many of you were thinking about naturally trying to conceive this year, or undergoing either fertility preservation like egg freezing or assisted conception. So it's a shame that I don't have those. Oh, people are raising hands. So does that mean, okay, cool, yay, oh, it must be a poll. Wow, it's magic. Okay, cool. Okay, amazing. So some of you are either looking to conceive this year or are undergoing treatment. I hope that's what it is. I'm too scared to click on the chat now in case something goes wrong. Okay, so there are different lifestyle factors that can affect fertility. So we're just going to look into these now. So firstly, sleep. So sleep is essential to our overall health anyway, good quality. and good quantity sleep really can play a role. And that's because it can have a huge disruption to our hormones as well. So our stress hormone, but also our appetite hormone, and our cycling hormones. So there's some research to say that under 5 to 6 hours per sleep per night has been shown to negatively impact fertility, and also that poor sleep has been associated with negative effects on sperm quality and testosterone levels. So some tips there to improve sleep. I'm sure if you struggled before, you probably tried them, but minimizing blue light before bed, making sure that your room is nice and cool. You could have a shower to do that as well, to sort of increase your temperature and then drop it before bed, and mindfulness. Okay, so in terms of stress as well, we know that there is an association there in terms of the people that are experiencing infertility have increased levels of stress, and we don't know whether it's a cause and effect when it comes to stress, but we know that the infertility is associated with increased levels of stress, anxiety, and depression. I am just going to quickly. Okay, fine. Okay, I'm just checking the chat box because I saw loads of hands go up and messages, and I just wanted to check that I didn't miss anything. But I think you're all. Oh no. Okay, phew. Okay, exercise. So we know that regular moderate activity reduces the risk of infertility compared to those who have low levels of activity. But again, as I mentioned before, it is about balance, and putting too much of a stress on the body could cause your body to, especially not having enough energy from food, could cause your body to go into fight or flight, and that's what we don't want to happen. We just want a nice balance, but we do know that it's beneficial for fertility. We know that smoking is really damaging for egg health and sperm health. So male and female smokers are about twice as likely to have fertility issues. Smoking during the prenatal period appears to increase the likelihood of the child being overweight, increases the risk of miscarriage, some research has shown, and negatively affects our important reproductive hormones. Alcohol, we know again to have an impact on our cycling hormones. So those ones that we looked at earlier, your FSH, LH, estrogen, and also your progesterone. So the safest approach is to abstain from alcohol altogether, and that's to keep risks to the fetus to a minimum. We know that alcohol can also increase our risk of miscarriage and time to conception, but also large amounts can affect the fetus. And the advice really is that because there's a chance that when you get pregnant, or if you were to get pregnant, you wouldn't find out straight away that you were pregnant, and therefore, you're not going to necessarily find out until a few weeks later. And so therefore the advice is to abstain. I guess in reality, for some people, it is going to take people, like, they're not going to get pregnant on the first go. And it can take people up to 12 months to get pregnant or longer. And so realistically, if you do enjoy having a drink, it can be difficult to, abstain totally for that whole length of time. So we do also have to be realistic. So, it's good to know the evidence. Nice guidelines actually say when you're actively trying to conceive, just to not have any more than 1 to 2 units per week. So, something to consider there. But likewise with recreational drugs, so cannabis, cocaine, ecstasy, ketamine, and amphetamines, we also know that these can contribute to fertility problems. Okay, so what is the best diet in terms of fertility? So the pro-fertility diet is the best research comes from the Mediterranean style diet. It's regarded as one of the healthiest diets in the world in terms of lots of different health parameters. So actually in terms of things like reducing dementia and heart disease risk. But again, there's lots of research in terms of its benefits for fertility. So the evidence shows improvements in sperm parameters, including quality, sperm count, motility, and concentration. beneficial to those with PCOS in terms of regulating periods, ovulation, reducing inflammation, and insulin resistance. There's a higher probability of success for those undertaking IVF, and a reduced risk of ovulation disorders. And there's some evidence to show that diets opposing this way of eating, so more sort of a westernized style diet, so ones that are rich in saturated fat, that have been associated with an increased risk of spontaneous early miscarriage. So what does the Mediterranean style diet look like? I'm sure you probably all know anyway. However, these are kind of the key foods that it encompasses. So one of the big ones is oily fish. So oily fish contain omega-3 polyunsaturated fatty acids. So there's an acronym to help you remember those. So it's salmon, mackerels, anchovies, sardines, and herring. But also trout is one because it's similar to salmon, so actually smashed, it's a good way to remember it, like smashed sardines on toast, which is like I'm sure the recipe that I recommend the most to people. I just love it, it's delicious. So yeah, the recommendations are 1 to 2 portions of oily fish per week. So a portion is 140 grams of cooked fish. So to put that into perspective, again, referencing the sardines, but a tin of sardines at a drained weight is about 84 grams. So, once you've drained out all the oil or kept the oil, but yeah, 84 grams of fish. And so we don't want to have any more than the 2 portions per week, because they can contain high levels of PCBs, which are sort of pollutants in the sea. So just the 1 to 2 portions per week. And there's loads of evidence for the benefits of omega-3. So it's an antioxidant, and we know that it reduces inflammation, so that can help with conditions like PCOS and endometriosis, but also in terms of benefiting egg health, sperm parameters, and also people undergoing assisted reproduction. So that's oily fish. If you don't eat fish, then the alternative is that you could look at supplementing with an omega-3 supplement. So one that has EPA and DHA. And so you want to go for the equivalent, so 400 milligrams of the EPA and DHA. So that's oily fish. So whole grains, things like quinoa, whole oats, brown pasta, brown bread, brown noodles, can't think of any others. So whole grains are really beneficial in terms of our overall health anyway. They're good for our gut health, but there's also some evidence for whole grains in terms of those who are undergoing assisted reproductive technologies. So for fertility treatment. And we also know that they contain lots of micronutrients, so lots of B vitamins, which are beneficial to fertility. And again, with carbohydrates, we want to find the right balance with them. So it is about moderation. So we don't want to, be having hugely high intakes of carbohydrates. But again, we want to make sure that we definitely have some of those in our diet. So things like berries and broccoli, so a variety of fruit and vegetables. So the reason that we want to go for as many different colors as possible is just because of the benefits from the antioxidants from the fruit and veg and the polyphenols. So literally just going for all of the colors of the rainbow and shaking up each week is really beneficial. And it just protects our sperm and egg cells from oxidative stress. We are actually going to send out an email after this with a fertility shopping list, and it will have some of those on there. So you should be able to, shake it up each week and pick different fruit and vegetables from that, just to make sure that you're getting as much variety as possible. Plant-based proteins. So actually high protein, again, for people undergoing fertility treatment, is shown to be beneficial. And in terms of female fertility, we know that opting for plant-based sources of protein seems to be more beneficial, and going opting for those more often than the animal sources. And so you can get that from things such as beans, pulses, nuts and seeds. Nuts and seeds is the next example there. Again, nuts and seeds are full of micronutrients. And so, for example, from walnuts, you can get omega-3s, and from Brazil nuts, you can get selenium, again, which are both antioxidants. Healthy fats. So fats are responsible for they're involved in the production of hormones, but also they help us to absorb the fat soluble vitamins A, D, E, and K, and so and which are also again beneficial for fertility. So going for the healthy fats as opposed to the more unhealthy unsaturated fats. So the healthy fats again come from things like the oily fish. Then we've also got polyunsaturated fats that you can get from things such as nuts and seeds, and oils, so things like olive oil and olives and avocado. In terms of eggs and dairy, so it's fine to include these in the diet, and again, they contain lots of beneficial nutrients, but we want to be including these just in slightly smaller quantities. But in terms of dairy, it's good to opt for around 2 to 3 portions of dairy per day. And again, it's okay to have some lean meat sources in the diet, but again, just sort of in moderation. So in terms of the microbiome and fertility, so when we talk about the microbiome, we're talking about all of the bacteria that we have in the body, and it's not just about the gut microbiome, it's also about the vaginal microbiome. When we see a disruption to the good bacteria, and there's a disruption, imbalance within our gut, it can lead to something called dysbiosis. And so this is kind of relatively a new sort of area of research in terms of fertility, but what we know from the research so far is that low levels of lactobacillus in the vagina have been linked to increased inflammation, miscarriage, and implantation failure, again due to vaginal dysbiosis. And there's some recent research showing that the use of probiotics may improve sperm health. So there are some tips there of how to increase probiotics into the diet. So it doesn't just have to be from a probiotic supplement. Actually, food first is in most cases is mostly beneficial to our health. So by making sure that you've got an abundance of fruit and vegetables in there to get your prebiotics to look after your gut, but also some probiotic rich foods in there, so things like fermented foods like sauerkraut, kimchi, probiotic rich yogurt, so the live natural yogurts, and also things like kefir. But also taking care of our vaginal hygiene, and avoiding harsh soaps and things like that, which will disrupt the balance and the pH of your vaginal flora. And we also know that there's a bit of a role there as well in terms of so people with endometriosis and polycystic ovary syndrome, PCOS, tend to have more sort of dysbiosis within their gut bacteria as well. So what should we reduce or avoid then? So what we want to try and limit is red meat and processed meat. Again, it's going to appear in some people's diet and is absolutely fine, but just trying to sort of limit that and make it not appear so often in the diet. Saturated fat we want to limit. We know that it's not good for our health anyway, in all aspects of our health, but we also know that saturated fat is especially not good when it comes to sperm health. Added sugar, again, we do know that this has an impact on both female and male fertility. Alcohol, as we discussed earlier, and caffeine. So the advice for caffeine is basically the advice that comes from pregnancy, and that's that we want to limit caffeine to no more than 200 milligrams a day. And so we know that a high caffeine intake during pregnancy is associated with an increased risk of miscarriage, low birth weight, and stillbirths. So what does this look like then? Well, if you are a coffee, tea, caffeine drinker, it can be a little bit difficult and scary at the start when you see this, because it's actually not that much. So for example, this is a cup of filter coffee, like one that you would make at home, and this tends to have around 140 milligrams of caffeine. If you were to go to a coffee shop, we don't really know how much is in a cup, and it completely varies from where you go, but it tends to be even slightly more than that. And also bear in mind, the coffees that you get from coffee shops tend to be double shot as well, so tend to have even more caffeine. Instant coffee tends to have a little bit less. Tea got around 75 milligrams, so you could potentially have 2 cups of tea in a day there. Green tea has about half of what black tea has, but then we can also get caffeine in other drinks and food as well, so Coca-Cola, for example, energy drinks, and it's also in dark chocolate and milk chocolate as well, so something to be mindful of. It can be quite hard to wean yourself off if you really like coffee or tea, but there are actually some really good decaffeinated alternatives now. You don't have to go like cold turkey. You can get replacements, and you can get nice replacements from coffee shops now. So you don't have to avoid it altogether. And we know that actually teas and coffees, because they're from plants, they are actually still beneficial to our health. So we don't need to avoid them, but we just need to be mindful of our intake. So what else should we be avoiding? So basically the foods that are recommended to avoid in pregnancy, so which is important at this time when we start actively trying to conceive, we want to be avoiding at this time, again, because you might not realize that you're pregnant yet until a little bit later on. So what we want to be avoiding is limiting herbal teas to no more than 4 cups per day. Be mindful and avoid licorice root. Licorice root makes an appearance in quite a lot of herbal teas. There's like one brand in particular that pretty much puts like licorice root in every single one of their teas, even like lemon and ginger. So just make sure that you check the packaging as well, because as I say, it does appear in quite a lot of them. Raw shellfish, raw meat, unpasteurized cheeses, and mold ripened cheeses we need to be avoiding, just because of the risk of food poisoning. And if you were to, it's uncommon that it would happen that you would end up getting food poisoning, but if it were to happen and you were to get really sick, it could increase the risk of miscarriage. Liver and liver products. So liver is extremely high in vitamin A. You may have seen, is it Heidi Pratt, that was in Big Brother and the Hills? She was like advocating eating raw livers, like from cows. And so we already know that raw meat should be avoided, but also liver, because it's toxic when we consume a high vitamin A, so it can harm the baby, and also it can contribute to miscarriage as well. So there's 2 different forms of vitamin A. There's carotenoids and retinols. Carotenoids come from the orange fruit and veg, and they're absolutely fine. You do get some retinols in dairy, but it's not in such a high amount. But in liver and pate, it is extremely high and should be avoided altogether. And the other one is retinoid like products, so like face cream should be avoided as well, because again, that can contribute to miscarriage. Opt for eggs with the British Lion stamp. Fish high in mercury should be avoided, so no more than 2 tuna steaks per week, 4 cans of tuna, and shark, marlin, and swordfish, but we don't really eat that so much in the UK, so we, it's always cold and but they're not really accessible to us, those fish, so much. Endocrine disruptors, we don't want to get obsessed with it, because, and I'd say that for everything that we're speaking about today, but we do know that has an impact on fertility, so trying to minimize exposure to these. So for example, by minimizing your exposure to BPAs found in plastics, so opting for like glass jars and stuff like that instead, and don't heat stuff up in plastic in the microwave, or put it in the dishwasher. And certain medications, one example in terms of sperm health is finasteride, that's used for hair loss in males, that can cause fertility issues. So sperm health, so when we're looking at a healthy sperm, we want good quantity, good motility, good morphology. It's equally important for males to optimize their nutrition. And, you know, regardless of whether you're in a same-sex female couple, you're in a heterosexual couple, or you're embarking on single parenthood, it's really important for you to optimize your nutrition, you know, in equal parts depending on your situation. So there are some factors that affect male fertility: age. So we know that as males age, the risk of miscarriage does also increase. Heat to the scrotum, so tight cycling shorts and things like that can have an impact. Physical activity, recreational drugs, smoking, pollution, genetics, medical conditions, weight and alcohol. We know that infertility in men is on the rise as well, and whilst we don't know the exact cause, likely a lot of that is due to lifestyle factors. So in terms of the foods that we know to be associated with good quality sperm health from the research: fish, shellfish, seafood, poultry, cereals, fruit, veg, low-fat dairy, although that's inconclusive at the moment, and a poor sperm quality: processed meat, soy foods, sugar-sweetened beverages, full-fat dairy, potatoes, coffee, or caffeine specifically again, and alcohol. And we know that a low and a high BMI both have an effect on sperm parameters. Fun fact: 75 grams of walnuts a day results in improvements in sperm count, motility, and morphology. However, I did actually weigh out 75 grams of walnuts, and it is such a large amount. It's like, I don't know, like 25 walnuts or something. And so that's like almost half a pack of one of those huge bags of walnuts. That is incredibly expensive. Also, you know, it's not, I do really like walnuts, but I think that's a lot of walnuts to eat. Also, although we do have some healthy fats in nuts, they do also contain saturated fat as well. So I think this just highlights you know, about having everything in moderation. So although the research has shown the effects at 75 grams, if if there's a man watching this, or you have a male partner, if you could, and they don't currently eat walnuts, you could just try by start implementing some walnuts into the diet, but you don't need to go to town. But walnuts, as I said earlier, are a source of omega-3, so it could be that the reason that it was shown to be beneficial was because of the omega-3s. So supplements then, so recommendations for preconception health. Everyone should be supplementing with folic acid. So general recommendations of 400 micrograms every day through conception up until 12 weeks of pregnancy. And some people who are at risk of neural tube defects will have to take a higher dose that should be prescribed by a doctor. It's for some people with a BMI over 30, diabetes, celiac disease. And the reason that we take folic acid is to reduce neural tube defects, but also we know that there's a role there in fertility in terms of egg quality, ovulation, maturation, and implantation. Vitamin D is also recommended, 10 micrograms a day of vitamin D, especially throughout these winter months. So the government recommendations anyway are that we should all be supplementing with vitamin D, 10 micrograms a day. It's important, especially when we get to pregnancy as well, because it can build your baby's bones and teeth, but also maintain your own bone mineral density. And we have receptors for vitamin D all over the body, including the ovaries. So we know that there's some research there that shows that there's with vitamin D intake, there's a greater frequency of positive pregnancy tests, clinical pregnancies, and live births for people undergoing fertility treatment. And we also know that people with PCOS and endometriosis tend to have lower levels of vitamin D. If you are vegan or a strict plant-based eater, then make sure that you're considering supplementation with vitamin B12, iodine, and omega-3 polyunsaturated fatty acids, because those are difficult to get from a plant-based diet. Supplements for men. So should men be taking supplements? Well, there's really good evidence in terms of sperm parameters for men from supplementing with antioxidants. So actually for females, it seems more beneficial to get the antioxidants from the diet. likewise, we want men to get their antioxidants from the diet as well. Like I said, food first approach, but people can consider a supplement with antioxidants in there. So like your vitamin C, E, your zinc, selenium. However, like all supplements, caution, excessive use of antioxidants can be toxic. And it's the same with all supplements as well. Like quite often I'll get people coming to me and they're on so many supplements, a lot of herbal supplements and, you know, high doses of vitamins, and we don't necessarily need them, and it can be harmful. So just go with what the research says, the recommended amount, and nothing more. You can opt for a preconception supplement for female health, and it generally will have some of these micronutrients in down here, and, you know, it will have folic acid in and vitamin D. So make sure that you're not taking folic acid and vitamin D in addition to a preconception supplement. Just some other nutrients that are really crucial to look out for. So iron, I mentioned earlier that there's that can be involved there in fertility issues, actually from a male and female perspective. So there's some food sources there, some plant-based sources, good evidence actually as well for female health in terms of the plant-based sources of iron. Iodine, I mentioned earlier about its role in thyroid hormones. Here's some food sources here. It's good to get iodine levels sort of stable before we embark on pregnancy as well. Just to say, well, I have this thought as well. If you are haven't implemented any of this stuff before, and you're not sort of looking at this 3 months prior to conception period, you are already actively trying to conceive, and, you know, perhaps have you know, haven't abstained from alcohol or anything like that, don't worry. Like for most people, you know, not everybody knows this information about preconception health, and, you know, education has notoriously been pretty bad in school and throughout our lives. So don't worry, but now that you know this information, it's just good to, you know, carry on from here. You know, it's unlikely that you would have caused any harm. It's just, you know, it's just good to start implementing this as soon as you can. Folate is the food form, natural form of folic acid. And there's some food sources there. Again, it will be in the fertility shopping list that we send you. Choline, not so important for fertility, but we don't have any recommendations in the UK for choline per day. However, we do know that choline plays a huge role during pregnancy. Likewise, calcium does. So those are kind of key nutrients to focus on there. But choline plays a role in preventing neural tube defects as well. So in terms of other things that you can look out for your preconception health checklist, check in on your oral health. Pregnant women are more prone to gum disease. Pre-pregnancy checkup, if you have a health condition or you're on medication, go and speak to your doctor. For example, if you have diabetes, type 1 or 2, is, as I mentioned earlier, good to have it under tight regulation, and you may have to have eye tests, kidney tests, and they may want to change your medication as well. So make sure that you inform your diabetes team. Check in on your hormones, take a fertility test, and see what your hormones are doing. You know, we haven't got, we'll get into exactly what the test does in a minute, but you know, it can be useful just to see what's going on from your ovarian reserve perspective, but also, like we said, the important hormones there, the ones that are involved in regulating your cycle, ovulation, and your thyroid hormones, vaccinations and screenings, and nutrition you know, tailored one-to-one support. Because as I mentioned, this is kind of, you know, this is just recommendations for sort of general population, whereas tailored one-to-one support is going to be more beneficial for you know, targeting specific areas that need help. So when should you seek help, and aware that we're running out of time, so sorry if I'm talking really fast. So if you're under the age of 35, we say after 12 months of actively trying to conceive, go to your doctor and seek help. Go to your GP, and then they can look into that for you and, you know, refer you on to the NHS if needed, or private if you would prefer to go privately, but they can start those investigations. If you're over the age of 35, it's 6 months of actively trying to conceive. If you've got a reproductive health condition, for example, like PCOS, then again, go after 6 months of actively trying. So it may just be that you need a helping hand, maybe some medication or something that could help. We know that 1 in 7 couples will experience infertility. You know, whilst we know that nutrition can help, it's not always the answer. And we do know that 16% of couples will fail to conceive after 1 year of actively trying. So take-home messages are: work on some of these positive behaviors there. So either choosing some more sort of negative behaviors that you can avoid. So for example, maybe quitting alcohol, and then working on some of those positive behaviors. So increasing movement, working on mindfulness, your nutrition, and then, as I said, quitting smoking or alcohol, and making sure that you are on top of your checkups and investigations. You know, to make it easier, you can cook together with a partner, reward yourself with achievements. But I think the main thing is to go easy on yourself, because it can be really a really anxiety-inducing time, and lots of people compare themselves to other people and their friends and their family, and you know, it's really individualistic, our fertility, so it's not good to compare ourselves to others. Everyone's situation is different. And with that being said, the way that you can check in on your hormone and fertility health is by doing a fertility test, a fertility test. So you can scan this barcode here, and it should take you straight through to the website, and we get you to fill out a virtual health assessment. So the test isn't just only for fertility, like I said, although we do test your anti-Müllerian hormone, which is an indication of your ovarian reserve. So we can determine what your egg reserve is, but also I think importantly we can determine if you have a hormonal imbalance there as well, so which is really important, especially for in PCOS as well, and it helps us to sort of especially if you were to go through tailored nutrition support, to see what management is best for your individual circumstances. We can also diagnose gynecological conditions, and we can also detect the onset of menopause. If you do want tailored nutritional support, you know, as I mentioned, that goes more in depth than this, and to target specific areas that may need some work, then you can book nutrition consultations through the website. Again, you can scan this barcode here. I know that I'm like a minute over now, so I don't know if there's time for questions or not. Okay, I'm just looking at the questions. I mean, I'm totally happy to stay on. So we scan the code and go from there. Yeah, exactly. You can just scan the barcode on the screen, and it will take you to fill out a virtual health assessment on the Fertility website. It just, we ask things like medical history and any symptoms that you're experiencing, because when the doctors interpret your blood test results, we look at them in relation to any symptoms or medical history that you've got, as opposed to just the blood test in itself. Yeah, correct. You don't have to have bought a test with me either. You can just sorry, you don't have to have bought a fertility test to book in with me. You can just book in with a nutrition consultation without the test. But it can be useful for me to, you know, depending on your situation. Also, to mention as well is that we do also have fertility advisor consultations as well. So I mentioned that I'm a nurse as well as a nutritionist, and so we do have 20-minute fertility advisor consultations with either me or one of the other nurses, and again, it's to either discuss your fertility or your hormone health in a 20-minute consultation. So just in case you're a little bit confused about your results, or you want to sort of explore what your options might be from there, whether you want to undergo fertility treatment or natural conception, or it's not about fertility, it's just about your hormones, or it's PCOS management. Hi
Emily, it's just Nancy. I'm just dropping in. Hi everybody, I'm Nancy. I run the social media for Fertility. We've had loads of questions. I don't know if you can see, Emily, at the bottom there's a Q&A, specifically dedicated Q&A box.
Wrong one. Okay, go on here now.
Okay,
thank you, Nan. Okay, I'll run through some of these, shall I?
Sure.
Okay, thank you. So there's a question there about vegan diets, so I spoke about some of those key nutrients that if you do follow a vegan diet, to make sure that you implement. So in addition to all of the other supplements we recommended, so folic acid and vitamin D, you want to be focusing on the omega-3s, iodine and vitamin B12. And to answer your question, is it better to take dairy for healthy fertility? So like I said, there is some research in terms of full fat dairy, in terms of female fertility. However, if you don't eat dairy, or dairy doesn't agree with you, it's really not the end of the world. It's just that, you can get some, dairy is rich in protein, and it does have some micronutrients there that are beneficial to us, like calcium, vitamin B12. But again, if you're supplemented with the vitamin B12, you're going to be covered there. And you can make alternatives as well, for example, some soy products as well. Will having been a smoker previously impact fertility? So yes, it can. So in terms of your egg reserve, and I spoke a moment ago about your AMH and the decline in ovarian reserve as we get older. We know that factors that can have an impact on our ovarian reserve are environmental factors such as pollution, but also smoking. And so so smoking could have contributed to decline, and actually even passive smoking as well. But it could have negatively impacted it. Alternatives for fish, I answered that one about supplementation. Any advice for celiacs in relation to the Mediterranean diet? So I guess making so some of those whole grains that I spoke about earlier, for example, quinoa. Quinoa is a good one as well, because it's so high in protein, but also things like beans and pulses. Beans and pulses are absolutely full of micronutrients, but also, again, like I mentioned, just really making sure that you're making sure that your celiac is under tight regulation as well, especially within this time. Any foods increase your chances of conceiving twins? I don't think so. Interesting question, but not that I know of. I've answered a lot of these questions about the probiotics. I'm skimming over some of the really sort of specific medical questions. If you've got really specific questions, again, as I mentioned, you need to book in with a health professional, whether it's going to be a gynecologist, whether it's one-to-one nutritional support where I've got your full background and your medical history, or a fertility advisor appointment. Just wondering if there's any multivitamins or supplements that you shouldn't take for preconception. Yeah, good question. And yes, correct. So this is why, if you're going to take multivitamins, opt for the preconception multivitamins as opposed to just multivitamins, because multivitamins usually have vitamin A in them, and as we saw, we don't want to be consuming vitamin A through the diet, because it can be harmful to the baby. Someone's asking specifically about eggs in moderation. How many eggs per week are we talking? I mean, like, realistically, it's fine to have eggs every day, but realistically, how many eggs are you going to have in one day? I guess, like, most people generally aim for like 1 or 2 eggs per day, which is absolutely fine. The thing is, yeah, everything in moderation, because let's say if you are having eggs every single day, then it maybe means that you're not having so much of a variety, because you could perhaps look at alternate things. For example, if you are having like egg on toast every day, then perhaps a different day you could have avocado on toast with loads of seeds on top. One of my favorites. In terms of progesterone levels, so someone asked, in terms of maintaining progesterone levels, are there foods that help to maintain levels? I understand that low progesterone can contribute to miscarriage. I also want to know why fertility tests don't test this. Is it due to the levels being naturally low at the time the test is taken? Yeah, correct. So progesterone levels fluctuate throughout the month. And for some people, specifically, if there was a cause for their progesterone to be looked into further, then generally you might have a day 21 progesterone test, but we do tests on day 3 of your cycle, just because it gives us a good baseline, and for those the other cycling hormones, so the luteinizing hormone, follicle stimulating hormone, and estradiol. So that's why there are a bunch of foods that can help in terms of maintaining progesterone levels, and also just maintaining the integrity of the endometrium in general. So for people listening, we want the environment of the lining of the uterus to be as optimum as possible, so that the embryo can implant there before the placenta takes over. So and ways that we can do that. So there's research in terms of vitamin E, although not so much research, but it's quite small, but there is some research. So it's from things like healthy fats, and avocado, whole grains, trying to think of them all, vitamin C, although don't quote me on that one. Omega-3s can help with the endometrium, because again, they help to reduce some of the inflammation that's associated, that can be associated with certain conditions. So again, it helps with the environment. So that's that one. Would you recommend CoQ10 supplement for ladies in mid-30s trying to conceive? So mid-30s, yeah. So for people who are under the age of 35, they don't necessarily need to supplement with coenzyme Q10. From the research that we've got, we do know that coenzyme Q10 can be beneficial for females over the age of 35, and that's because, as I mentioned earlier, the quality of your eggs does start to decline, but coenzyme Q10 is an antioxidant, and it's heavily involved in the energy of the cell, when the quality of our eggs starts to decline, the sort of energy within that cell starts to decline, and that's why coenzyme Q10 is beneficial. But in terms of the research, there's not loads at the moment, and especially in terms of the quantity. But if you are going to take it, you need to be mindful that you don't go over the maximum dose, and really with an antioxidant, it's best to sort of split it up throughout the day, because that's naturally, if you were to eat antioxidants throughout the day, you would get like a sort of a gradual amount of them spread across the day. So that's the advice of coenzyme Q10. It does also interact with some medication as well. Also something to be mindful. So if you're going to start supplementing with something like coenzyme Q10, then speak to a health professional first, before just taking, before supplementing with it. Does caffeine affect sperm too? Yes, it also can have an impact on sperm health. Caffeine, lots about caffeine. Will switching to decaffeinated tea and coffee help? So potentially, yeah, and it's something to consider if you have been experiencing, or you have experienced previous miscarriage or ongoing miscarriages, then it could be something to consider. And actually, we know that limiting caffeine, especially in the when people are going through IVF, seems to be really important as well. So can help, yes, because as you said, it can increase risk of miscarriage. So trying to keep it under that 200 milligrams a day. Particular recommendations for ladies with low AMH. If it's with regard to nutrition, unfortunately, like I mentioned, vitamin D really is the only association that we know there, and there's not really anything else that you can do in terms of dietary aspects. So you'd be more so sort of looking at, do you need to sort of have these conversations about natural conception if you have a partner sooner, or might you want to be looking into preserving your fertility through things like egg freezing? We do have a partner clinic if anyone did want to be referred, so feel free to get in touch if anybody wanted any more information about that. When you're trying to conceive, is it okay to be in a calorie deficit and trying to lose weight? So I would say no to this answer, because when we're in a calorie deficit, we are likely not consuming as an ideal amount of nutrients or potentially energy, and that can have a knock-on effect to our menstrual cycle. But again, with this, it depends on your individual situation, because for example, let's say you have a high BMI and you've been told that your only way to access fertility treatment is to lose weight, which it isn't necessarily the only answer, but unfortunately there are very biased BMI cutoffs. But in that case, it might be, that it's kind of the only option for you. And if that is the case, then I'd say that you need to do it in a really, really slow and gradual way, and under with support of a nutritionist or dietitian, because, as I said, it can have implications on your fertility. Okay. Once the quality of your egg starts to decline, is it possible to restore it? So as I mentioned, it does start to decline with age, and there isn't anything that we can do from an age perspective. However, from a dietary perspective, there are things that you can do, a dietary and lifestyle perspective, to protect the quality of the eggs and also the quality of the sperm as well. So you really want to make sure that you're protecting it from oxidative stress, which damages the DNA of the cells. And so pretty much everything that we've spoken about today is going to help with that. So things that are involved in egg quality, we've discussed, so, all of the micronutrients and antioxidants involved in the Mediterranean style diet, but also making sure that you try and limit some of those environmental factors, so things like pollution and smoking and alcohol. It's a good question about vaping and sperm and egg quality. I'm not 100% sure in terms of fertility, but I know that our researchers will probably know the answer to that if there is some research yet. I don't know whether maybe it's, I think there is evidence showing that it negatively affects it, but don't quote me on it. We should look into doing a post about it. Seed cycling, really good question. So what are your thoughts on seed cycling? Would you recommend it? So if you've not heard of seed cycling, it's where people eat seeds at specific times of the month to sort of follow their menstrual cycle. To be honest, there isn't any good research in terms of seed cycling and its benefits. However, I think, like, if it makes you happy and you enjoy doing it, then I don't see any harm in it, because you're incorporating seeds into the diet, which we know to be really nutritious. So I don't think there's anything wrong with it, but I think that people do sometimes get caught up on things like this, and it is a little bit more of a fad as opposed to being evidence-based. So is there a recommended daily limit of saturated fat? 10% of your daily calorie intake. So it depends on what your weight is essentially, and your energy input and output. Is there any harm in taking prenatals if not actively trying or planning, or if planning to try to conceive in somewhat near future? So actually there can be some harm. So we know that supplementing, for example, for very long periods of time for folic acid, there's some sort of emerging research lately that's showing that it potentially could be harmful. So I think, you know, if you're not in a position where you're at you're doing it for fertility, or at the preconception stage, or, you know, actively trying to conceive, or pregnant, I think for everyone else, is always a food first approach, unless you've got nutritional deficiencies, or, you know, you're vegan. Yeah, we want to get our nutrients from food. As I said, you can take too much of a good thing. So really, you just want to be supplementing that preconception period, so like the 3 months prior to conception. That also answers the next question. Are we doing okay for time, Nance, or should I wrap it up?
I mean, you can go on for as long as you like. We're at 9:20 now. I did suggest that maybe we could copy down all of these questions that we've received and see if there's some kind of follow-up we could do that kind of addresses the main themes, because we have had almost 70 questions. So thank you everybody so much for participating and getting involved.
Yeah, okay, cool. Let's do that then, because yeah, I think you're right. I think like a lot of them are much of the same. So yeah, let's try and share them if we can. Are you still there, Nance, or did I close you off?
Yeah, no, I'm here.
Okay, or shall I do a few more? I don't know.
No, I think we're good. Yeah, just a reminder to everyone that you can book a session with Emily. Obviously, she's brilliant, and I would really recommend doing that. And also, you can join our Facebook community, which I've shared the link to in the chat, to talk to others who are in your situation. And yeah, just get involved in our community. Thank you so much for coming, everybody.
Thank you so much. Thank you, Nancy. Thank you so much, everyone, for joining. Thank you.